What are our finances looking like? We just went over finances in the
Sure,
board meeting.
absolutely. So we're working through that transition between our old computer system and the new computer system, and we knew that that was going to cause a little bit of a challenge from our finances perspective, and so we kind of planned for that. What we didn't plan for though was a cybersecurity event that caused us to be down even longer than we expected, and so we're a little bit behind where we'd like to be. Now, I'm only saying that because I really think our staff has done an amazing job in bouncing back from that. We're only about 1% lower from a volume perspective than we were last year. And that's really a testament to how hard all of the staff has worked since those two things happened back in June and early July. So, 1% difference in total volumes from year to year with adding in those two events. I really don't think you're going to find a better team of people that could have gotten through that than Woodlawn. I've been in healthcare 26 years. There is no other organization that I've talked to that has went through that kind of setup or situation in one calendar year. So kudos to everybody at the business office, at the accounting department, and all of those clinical people throughout the hospital that went from a new computer system to paper, back to a new computer system, all within about 6-8 weeks, and we're not doing too shabby. We did have a small loss for the month of 567,000, and a net overall loss of 293,000. But again, compared to where we could have been, it was a very good overall month, and very good over the last 6 months. Now, a couple things I want to note that are positive. All of the volumes are trending in the right direction. We're slowly moving up and continuing to build overall. Our rehab to home program, it's up 52% as compared to last year. Those are those patients who need just that little extra tender love and care, a little bit more rehab here, give them a little bit of a tune up, so to speak, make sure that they're safe going home. We've gotten a lot of referrals from outside our own little organization here, for that over the last year. And so 51% improvement year over year is pretty significant. And we continue to believe that that's going to keep growing as we keep working with those patients. And then babies. Who doesn't love babies? Our OB admissions are up 19.7% compared to 2024. We are delivering and seeing a lot more volume in the OB market. We are honored to take care of your families. It's just amazing, and we really, really are proud of that. So, thank you all for that. That's that vote of confidence and support. We continue to see that grow, and I don't think we've peaked out yet.
Definitely not.
And then the only other thing, from a financial perspective that we did do is we always give you an update of when we buy something. And so we did buy something to this. The board approved that. It is a water cleaning system, and so our lab has just recently purchased, and they're being installed and put in over the next couple months. Two brand new chemistry analyzers. So those are those big fancy machines that take our blood and they check for all of the different problems that could be out there. And we went from having one machine that had some limitations in all the tests that it could perform to two of the latest and greatest machines that can add a significant number of tests to them that we couldn't do in the past. So sometimes in the past, your doctor might have written an order for a test. We might draw the blood, but we can't actually do it in our own lab. So we have to ship that out to somewhere else. That costs more for everyone involved. Now we're going to be bringing back a significant number of those tests and doing them right here. Also, we're getting two analyzers instead of the one that we had in the past. These two will make sure that we never have any downtime. We can do maintenance on one, and the other one can take on the load, and vice versa. A lot of times when we had to have annual maintenance because our machines were a little bit older, and we only had one, we might have to divert some of those tests for several hours at a time. So we're very much looking forward to that. So board approved that. It was about $28,000 to make sure that the water going into those machines is completely pure. So that'll be being installed here in the next couple months as well. So financial side, everything's looking in the right direction. We're pretty proud of everyone.